new research showing that thousands of plastic surgery patients get hooked on opioids after their operations. In a study of nearly 500,000 people who had gone under the knife, 50,000 went on to use the highly addictive painkillers for longer than needed. And apparently the highest risk was among breast job and tummy tuck patients, likely because those operations can often be more invasive and painful than others. As plastic surgery rates skyrocket, researchers warn these findings show a specific need for guidelines on opioid use before, during, and after plastic surgery. Joining us to talk about this is our friend Dr. Stephen Mulholland, founder of SpaMedica and one of Canada's top cosmetic plastic surgeons. Dr. Mulholland joins us on the line. You're in Thailand?
Yeah, I'm in Thailand, Barb.
What do you do? What are you doing? Oh, is it March break in Thailand?
No, March break for our kids. We have them at this eco reserve and sort of working in an orphanage and experiencing life from a different perspective.
Oh, isn't that interesting? Oh, did you want to tell us a bit about that before we go on to the story?
Well, I mean, it's fascinating, and Thailand's quite, advanced in some respects in their management of the sort of Indian elephants. Used to be 300,000 of them. 100 years ago, it's down to about 200. So we're up in the north and working at a reserve and a after-school sort of orphanage with kids that don't have parents. So it's quite communal and community-oriented, and I think it's good for our kids to see that. We get quite locked up in our urban lives, and it's good to give kids a perspective at that age.
I was going to say, when I hear about students doing things like that, they often come back with perspective on what the world can be like for other people.
I think so. Kids were grumbling on the way there, but they're having a great time.
I'm good. I'm glad to hear it. I'm so glad. In terms of this story, so you are doing a lot of these procedures. Have things changed in terms of guidelines around opioid use and discussing it with patients?
I think every jurisdiction is different, but there are some facts that remain for sure. Cosmetic surgery is definitely on the rise, 1,000% increase in the past 10 years. And one of the most common things we do are breast augmentation and, of course, tummy tuck, and that involves working on the muscle. Many of our procedures, facelifts, upper lid, lower lid, liposuction, it's all mainly skin and under the skin and the fat. And it's not, it's not terribly painful, whereas some of these procedures that work on the muscle are painful. And then we've got a whole classes of new narcotics available that are very potent. And the addictive, people can get addicted within a week, certainly post-operatively. And so, and then we've got some jurisdictions in Canada and abroad that don't educate physicians as well as they should. And of course, patients are in pain and they're addicted, and they realize that, so they request more narcotics. And so it is a perfect and unfortunate crucible for addiction, and that's what we have. Many patients get addicted to narcotics after their cosmetic plastic surgery, and getting unaddicted can be very difficult.
So how do you go about managing that? Does that begin before the procedure?
It sure does. And so at my clinic, and I think in Ontario we're quite progressive, because the College of Physicians and Surgeons of Ontario has made this commonly known. The Canadian Society of Plastic Surgeons has discussed it and is forwarding a policy. But in general, I meet with patients and I tell them, it's going to hurt, and there's some muscle pain, and you're going to get exactly 10 strong narcotics, 10 tablets. That's it. And that will last you about 4 days. And we're talking like OxyContin, Oxyset, the Oxy brand, which is very, very effective pain relief, but extremely addictive. And after that, we're going to put you on to this new class of non-steroidal anti-inflammatory called ketorolac or Toradol. Now, unfortunately, this came from the UK. I don't believe the UK has Toradol available orally. It's a very strong non-steroidal anti-inflammatory, stronger than Tylenol 3 with the old codeine that we used to give all the time. But there's no addictive, no constipation, and no nausea side effects. And we can bundle that with some gabapentin and other classes of non-narcotics after the first 4 days to keep people very comfortable. And if you do that, you just don't have the addiction rates that clients and patients can get after a week or two on strong narcotics.
And this is not exclusive to cosmetic plastic surgery. We hear these stories with people who have, any kind of surgery that can often lead to an addiction to opioids. Do you think generally doctors are being careful enough when it comes to monitoring and managing the prescribing of opioids after surgery?
I think we've done a fairly poor job as surgeons as a whole. I mean, the article picked on breast dog and tummy tuck because, that has public sort of soundbite effect. Oh, we're creating these raving oxy addicts after breast augmentation. But the truth is that most addiction happens after surgery or chronic disease where a patient may have surgery but ongoing pain, particularly orthopedic pain, bone pain, spinal pain, cancer pain. These are, inflammatory bowel disease pain. These are usually where patients are going to get addicted because even the surgery, the intervention, or the medical treatment doesn't resolve the pain. And then doctors are under the pressure to treat pain, which is, pain is a serious issue and it needs to be treated. And then, unfortunately, the strong narcotics or opioids, which, again, are available without even seeing your doctor. They're so $25 on the street for an oxy. And so patients may not even get the prescription from a doctor. They may buy it in the street, or they doctor shop, and they go from one doctor to another and get multiple prescriptions. In Ontario, we have a database that's linked to the pharmacies, and that's greatly reduced the doctor shopping. But some provinces and many jurisdictions in the U.S. and the rest of the world don't have that.
Dr. Stephen Mulholland, thank you so much for joining us. When are you back from Thailand?
About a week, Barb. It's really difficult with this 30-degree weather to get enough sunblock on, but I'll try.
All right. Well, we'll have to talk about how we're going to deal with that the next time we see you. Dr. Mulholland, thank you.
Thank you. Thanks again, Barb. Bye-bye.
Dr. Stephen Mulholland, founder of SpaMedica, one of Canada's top cosmetic plastic surgeons.